Hello everyone, welcome to this series of lectures about Introduction to Pharmacology. In this series, we will discuss the major principles of pharmacology and the two terms that are applied to all medications, which are pharmacodynamics and pharmacokinetics. My name is Ahmed Al-Tarifi and welcome to these lectures. To start with, what is pharmacology? Originally, pharmacology consists of two terms, pharma and ology. And we already know that ology comes meaning this science in the old language, Latin language. However, pharma is in old language is poison or drug. So simply, pharmacology means the science of poisons or the science of drugs. So what are drugs or what are poison? Any substance that is used for prevention, treatment, and diagnosis of diseases are considered a drug. Examples, for example, of drugs that used for prevention. Water, for example, is used to prevent dehydration, and that's why water sometimes can be considered as a drug. Treatment, and this is very common, a patient comes to the doctor with a disease and we give him medication to treat his problem, such as high fever or infection, and that's why these drugs that the patient take are called drugs. And sometimes we administer drugs to diagnose diseases. And there are a lot of examples that we will study in the course of pharmacology. What are the tasks of pharmacologists, or what is the advantage of the science of pharmacology? Now, the major target of pharmacology is to find new medications or new medicine to treat or prevent or diagnose diseases. This includes screening for desired activity of medications, such as if you take chemicals from plants or animals and you screen these chemicals to find their activity in humans and if they are able to treat or diagnose diseases. Also, the pharmacologists determine the mechanism of action or the mode of action, which is another term we will study later, which is finding the exact pathway that these medications or chemicals produce their activity in treating that disease. And finally, pharmacologists go and quantify drug activity. So they make relationship between the dose or the amount of a drug taken by the patient to produce the activity. Now, simply, this is an example of a common drug that patients take nowadays. Most medications are usually come in such form, which is tablet or capsules or other forms that we will study soon. Now, this is what we see or the patient see when he buys the medication from the pharmacy. However, behind this, it's composed of atoms, usually carbon, oxygen, nitrogen, fluor. Any atom in the nature can be combined with other atoms and produce chemical. This, for example, is a drug called, from its chemical name, N-acetyl para-aminophenol, and probably you can read this chemical structure by help from the organic chemistry that you may study before. So N-acetyl, because we have this acetyl group here, so that's acetyl, and composed there is an atom connected to it. And that's connected to the phenol right here, because there's an OH with this 6 carbon ring. So that's a phenol, and para because these two extension, or these two side chains, the OH and the acetyl group, are opposite to each other. So N-acetyl para-aminophenol. This is the name of this structure, which is the chemical name. Now, this is in pharmacology considered a simple chemical structure, but some other drugs composed of very long chemical and atoms structure, and the nomenclature of these drugs could be hard to remember or hard to write for the patients. So they replace the chemical structure or the chemical name of the drugs to a simpler form, and that's called the scientific or generic name. So for example, the same chemical structure right here, it's the chemical name for the other generic name, which is paracetamol or acetaminophen. Usually there is one generic name for all medications. This drug is an exception. It has two different generic names, but they are commonly used in science. So this is the generic name, or sometimes they call it the scientific name of the drug. Because we have many pharmaceutical companies that may be able to synthesize and produce this drug, each company tried to sell their product to patients, and that's why they rename each generic name to a specific name that is connected to the company. For example, the same structure that has this chemical name and has this generic name, it has multiple trade names because each trade name is connected to a different company producing it. For example, we have Panadol, they still have the same chemical or generic name, Tylenol, and Pandarine. All of them are composed of paracetamol or from N-acetyl para-aminophenol. And if you look carefully to the box that usually the drugs are inserted inside, you can find the generic name just below the trade name. So the trade name here is Tylenol, the generic name is acetaminophen. You may find also other information from the box outside. You can find the form of the drug inside. In such case, it is a tablet, which is similar to the drug that was in the slide before. Also, you can find here at the corner what we call the dose or the amount of the drug. So each tablet composed of 325 milligram of acetaminophen. So many information that are labeled on the box can be given, and the patient can understand what is he taking for. Where do we get drugs from? So it depends on the drug. Some medications are actually taken directly from nature. Here is an example of iron supplements. People who suffer from anemia due to decreased iron, or what we call iron deficiency anemia. So we just replace them with this element. In such case is iron, but that also applies to other conditions such as folate or vitamin B and others. Some other sources come from bacteria or fungi, and the most common source of drugs are usually coming from plants. This, for example, opium poppy or a poppy plant. In Arabic, it's called Zahrat al-Khashkhash. That's where we get the morphine. It's a powerful drug to produce analgesia. Some medications that are taken from animals, examples are insulin. And finally, and nowadays it's very common, using technology or genetic engineering, where we can get a huge amount in short period of time of some medication, such as insulin. In this condition, we bring the bacteria, we infect or inject a vector or a viral virus that contain some sequence of DNA into that bacteria, and then once this bacteria start to grow and start to translate and the mRNA into proteins, so we take that protein and then the bacteria will keep growing and produce that protein in a huge amount, so that can be used to produce a huge doses in very short period of time. Now, pharmacology is a combination between an interaction between our human body that showed in the left graph and the drug or the chemical that we take, which is represented here in the right graph. So the drug can affect our body. For example, if we have a high fever or if we have infection, so the drug goes and decrease our body temperature or treat or fight the infection. At the same time, the body itself can also affect the drug. So there is a reciprocal relationship between the body and the drug, where each one of them is affecting the other. And the terminology in pharmacology is called pharmacodynamics for the effects of the drug on the body, and pharmacokinetics, where pharmacokinetics represent the effect of the body on the drug. And in any drug we will study in pharmacology, we should keep in mind what are the pharmacokinetics and pharmacodynamics of that drug, because knowing these two principles for each drug will help to understand the mechanism of action, as well as the side effects or any other indications for each drug on our body. Let's start talking about pharmacokinetics, which will be discussed in 2 lectures, and this one is the first one. Pharmacokinetics has 4 branches. It starts with absorption, distribution, metabolism, and elimination, which are symbolized as ADME. Before we go into the first one, which is the absorption, let's talk a little bit about the route of administration or the drug and side of giving the drug to the patient. We know there are multiple routes of administration where the patient can get the drug. This figure summarizes the routes of administration. The most common one, as probably you know, is the oral route of administration, by taking the drug orally, going into the GI tract. But other routes, including parenteral, such as intravenous, intramuscular, subcutaneous, sublingual, which is putting the drug under the tongue for a short period of time, transdermal, into the skin, topical and rectal, and many others such as inhalational and intra-articular. We will discuss all of them shortly. So routes of administration can be categorized into enteral route of administration or parenteral route of administration. Enteral means anything connected with the GI tract. So oral, for example, will go into the GI tract, so that is part of enteral route of administration. We have also rectal route of administration. These are suppositories, or in Arabic it's called tahamil. These drugs can be administered in the anal canal, and because that is part of the GI tract, so that's why they are enteral. The other branch is parenteral, which is any other route that is not connected with the GI tract. Examples of these routes of administration, and a very common one, is the intravenous or intra-arterial route of administration. We have intramuscular, where we inject the drug directly into the muscles. We have subcutaneous, we administer the drug in the subcutaneous tissue. And sometimes we give the drug directly into the CSF, cerebrospinal fluid, and that's called intrathecal drug administration, or sometimes they call it the epidural injection because it's in the epidural space, as well as intradermal. You can see here by giving the drug directly into the dermis of the skin. This is very common in diagnosing the patient with if they ever get tuberculosis in their life. They give a drug for a small drug into the dermis. If there is a reaction on the skin around the injection, so that is an indication that the patient was exposed to tuberculosis in the past. This is an example of the use of intradermal route of administration. And finally, we have sometimes we inject the drug directly into the joints. This is an example where we administer drug into the knee joint, and that's called intra-articular route of administration. We have other routes of administration, such as topical, by giving the drug directly into the mucosa. This is very common among dentists, giving the drug into the mucous membrane before giving the injection for local anesthesia. Or inhalational, this will go into the trachea and to the lungs and then absorbed into the bloodstream. And ocular, where we put the drug directly into the on the eye, and transdermal patches, where we put the drug into the skin for a long period of time, and the drug will be absorbed into the bloodstream. The drug will be absorbed into the bloodstream as long as the patch is on its place. A very common example is for patients who are seeking to stop cigarette smoking, and giving them a nicotine patch, so a patch that has nicotine, and that is absorbed into the bloodstream to help the patient to stop smoking cessation. Now, although there are classifications of these routes of administration, enteral, parenteral, and others, it's not very important to know these classifications. More importantly, you need to know the advantages and disadvantages of each route of administration on the patient or in the healthcare system. So we'll go one by one on them and see the advantages and disadvantages of each one of them. Let's start with the enteral route of administration, and specifically let's start with the oral route of administration. Now, in the oral route of administration, they usually come in different forms. Some of them will be capsules, and from its name, capsules mean there is a capsule. We can see in the middle graph right here, there is a capsule where if we open between those two different colors, there is a powder inside. So the capsule will protect the powder inside from external environment that may destroy the powder inside. And a very common environment that we need to protect the powder from is the acidic media in the stomach. So putting the capsule around the powder will help to avoid the acidity in the stomach that may destroy our drug. Tablets, and this is also a common form of medication. Some capsules may come in a hard gelatin, such as the middle graph, or a soft gelatin, which is on the right. Example of this capsule is on the right side. But again, both of them will help in protecting the active ingredient that is located in the middle of that capsule. We have also a syrup, and that could be a suspension or elixir. Elixir, it is very clear, and usually it's very liquid. Some of them may become more viscous, that's may called syrup. And then we have suspension, and in suspension, the active ingredient cannot be dissolved completely into the media that it's located in. So you can figure out this kind of a drug by looking at the bottle against light, and you can see that there are some particles that is suspended into the media. So it is important in the suspension case, every time the patient will use the medication, he or she needs to shake that bottle carefully, because if the patient does not shake that carefully and strongly, the active ingredient may sit at the floor of that bottle, and the patient, if he try to get the material, he will not get the particles that contain the active ingredient. So they need to shake it first before they can take the dose of that drug. Now let's start with the oral route of administration. Some advantages of using such route of administration: it is very convenient, it's the most common way of giving medications to patients. It's considered cheap compared to other routes of administration, and that's why it is very commonly used, as well as it's easy for the patient. It does not produce any discomfort. With the presence of capsules, any bad tastes can be covered by the capsule, and the patient will find it very easy. So these are very important advantages of such route of administration. However, sometimes the taste of the drug may produce a bad taste or a bitter taste, and that's why some medications, although it's now very low in number, because again they use capsule to avoid such problem, but still taste sometimes will not be favorable to patients. Also, we have a problem with compliance. Compliance means that the patient has to stick with our guidelines, with the doctor's guidelines of taking the drug. So the patient will go back home, and he or she needs to take the medication in a specific schedule. For example, if the patient will take the medication 2 or 3 times, that means every 6 hours or 8 hours or 12 hours, the patient has to take that medication. So the more frequent the patient needs to take the medication, the less compliance, because the patient sometimes will forget to take the medication on time. You need the compliance and you need the cooperation of the patient to take such medication on time. So in oral route of administration, they try to decrease the number of times that the patient will need to take the medication per day. So that's why sometimes 2 times per day, 3 times per day. But if the patient will take the drug 6 times per day or 10 times per day, that means every 2 hours or 4 hours. So there is a high risk that the patient will skip one of the doses and he will not take the drug as needed. So in such case, it's better to be given by a nurse, as we see in later slides. Also, oral routes of administration is not favorable and not indicated, and actually it is contraindicated in patients who are unconscious, because if there is a high risk that unconscious patient will not swallow the medication. He or she may aspire, which means the drug will go into the trachea and the lungs and produce more problems to the patient because he cannot control swallowing. So in unconscious patient, we avoid giving anything to the patient, including drugs as well as water. Unconscious patients, we don't give them anything in their mouth. And finally, and a big problem with oral route of administration is that the variable bioavailability. And this is a common name in pharmacology, which is the bioavailability. So what is bioavailability? Bioavailability simply is the amount of a drug that reaches the systemic circulation after oral route of administration. So on the right side here, we have the esophagus right here. This is the stomach, and then we have the duodenum or small intestine. We take the medication into our mouth, which eventually will go into the stomach. While it's in the stomach or the small intestine mainly, that's where the absorption mainly will happen. That will go into the portal circulation, that will connect the GI tract to the liver, and in the liver we have some enzymes that may degrade or metabolize the drug or any other ingredient in the GI tract, and whatever left of after the metabolism, that will go into the systemic bloodstream. So if we take the drug orally and go to the GI tract, we have some obstacles in between. We have the absorption, and then we have the metabolism before it go into the systemic circulation, and this is the inferior vena cava. Because of these obstacles, not all the dose that we take usually goes into systemic circulation. Some of them will not be absorbed, and some other will be metabolized and degraded before they reach the systemic circulation. And that's what's called bioavailability, which is the amount reached into the systemic circulation compared to the actual amount that was ingested by the patient. The less metabolism and the more absorption, that will increase bioavailability. However, if we have less absorption from the GI tract to the bloodstream and a high metabolism in the liver, that will decrease the bioavailability of the medication. Now let's move to the next example of enteral route of administration, which is rectal. In rectal, we can give suppositories or tahamil, as we can see in this figure, or sometimes we can give what's called enema or ointment, such as enema. It's like shown in this picture, where fluid can be injected into the anal canal. Sometimes this is used to enhance the defecation of patients who suffer from diarrhea, and sometimes is to clean the rectal canal, especially before the surgery that involves the area. So what are the advantages and disadvantages of rectal route of administration? In general, they are cheap, and they are good to be given in unconscious patients, in pediatrics, and in patients who suffer from vomiting. Because a patient who vomits a lot and you give him or her oral drug, so there is a high chance that the drug will not reach the systemic circulation because it will be vomited frequently. However, rectal has some disadvantages. It also has variable bioavailability similar to the oral route of administration, because part of the rectal canal is associated with the portal circulation, so it will go to the hepatic system, and some of the drug may be metabolized, and it may produce irritation to patients. And let's talk about another example of enteral route of administration, which is the sublingual. You can see here that sublingual, you put the drug directly into the floor of the mouth beneath the tongue. The area there is very thin, where the mucous membrane is not a problem for the drug to be absorbed directly into the systemic veins, as you can see here at the bottom of the tongue as well as at the floor of the mouth. So it has some advantages and disadvantages. It has no first pass effect. It does not go to inferior or superior vena cava. It does not reach the hepatic circulation. It's absorbed directly into the bloodstream here and goes through the superior vena cava into the heart, and then the heart will pump that drug with the blood to the different parts of the body. It has a fast onset of action because no need for time for absorption or metabolism and all this circulation we saw in the oral route of administration. So this is a lot of times indicated in patients who have problem in their chest, especially those who have ischemic heart disease, especially elderly, where when they take the stairs and they start to have a chest pain, so they take this drug directly into the floor of the mouth and the symptoms will disappear. Better taste, that's a disadvantage where it can, depending on the drug, remember that you need to put this medication beneath the tongue for 10 to 15 minutes until it's fully absorbed. So it has a bad taste or a better taste. It will not help a lot the patient. Also, it is not indicated, of course, and contraindicated in unconscious patients because, again, we are afraid that this drug may slip into the respiratory system and does not go into the GI tract, producing further problems. So we finished talking about enteral route of administration. Let's move to the advantages and disadvantages of parenteral route of administration. Before we proceed, we already mentioned that we have different routes of administration for parenteral route. And the way or the technique that is used to determine which part of the skin we aim to give the medication, depending on the angle where the needle is injected into the skin. If it's vertical or 90 degrees, that is for the intramuscular route of administration. We reach the muscle here and we put the drug right there. If we tilt the needle a little bit, 45 degrees, so now we are in the subcutaneous tissue. If we further tilt the syringe, so it will be reach now the intravenous, the veins, and then if we tilt that even further, 10 to 15 degrees to the skin, so now it's intradermal, as we can see in this figure right here. So what are the advantages of this route of administration? They are perfect and the drug of choice in unconscious patients. They have 100% bioavailability because they don't suffer from a problem in the absorption from the GI tract. Also, they don't go directly into the hepatic circulation. They go directly in the systemic circulation to the heart and then to the body before they go into the liver. They have a rapid effect, and that is a big advantage, especially in acute cases. For example, if a patient comes to the clinic suffering from a condition called anaphylactic shock, this is a very severe and emergency condition. The heart rates are fast and there is a decrease in the blood circulation in the system. So of course the drug of choice given in such case is given subcutaneous or intravenously, so we can save the patient's life. Again, it has some disadvantages. Some patients suffer from some such of pain. Could be mild, could be severe. Because we penetrate the skin, still there is a risk of infection. So patients, before the injection, we usually swab the area with alcohol or iodine. As you can see, this reddish area here, that's iodine, so that we disinfect the area. And because we use a syringe, and sometimes you need a nurse to help you in administering the drug, so that will add to the expense of this medication, of these routes of administration, and so that is a disadvantage. Now, the drugs that are given parenterally, muscular, intramuscular, or intravenous, they come either in ampules, such as shown in the left side, or vials, as shown in the right side. The difference between them is that ampules, usually we break the top of these little glasses and we use the material inside that contains the drug for one time. We inject it directly to the patient. The vials, on the other hand, there is usually a huge amount of the drug inside, so each time we need to use it, we insert a new syringe into these little top rubbers, and we take the specific amount we want from the drug, and then we inject to the patient. So we use this multiple. Now we finished with enteral and parenteral. Let's move to others, and specifically let's talk about inhalational route of administration. In inhalational route of administration, the advantages: it has no first pass effect, and it may produce irritation, or the particles, the active ingredient that should go to the lungs, sometimes they precipitate in the mouth and they produce some side effects. A common example for those patients who suffer from asthma, they have sometimes take a drug, corticosteroids. These corticosteroids should go to the trachea, but from the mouth until they go to the trachea, some of these corticosteroids may precipitate in the floor of the mouth, and that may produce some fungal infections. They could be expensive because now you need to use the machine for that, and this may add to the price of the drug. The inhalational route of administration either come as inhaler. You can see in the right bottom of the slide where you take a puff while you are inhale the air from the outside, or a nebulizer where you have a bigger machine. It mixes the drug with the oxygen, and you just sit down for 10 or 15 minutes, and then you just keep breathing the material from that machine. And so that's for a long period of time. This is, you take 1 or 2 puffs whenever you need to use it. This just summarizes most of the route of administration: oral, rectal, sublingual, intrathecal, which is given directly into the cerebrospinal fluid. Transdermal, we talked about an example where we give nicotine patches for patients who want to stop smoking. Some other example is that some analgesics, such as a drug called fentanyl, is given transdermal. It lasts for around 3 days. You just put 1 patch, and then the patient go for 3 days before he come back to put another patch. Inhalational, it's rapid because it goes directly into the lungs where it's absorbed into the systemic circulation. Topical, such as creams, ointments, we talked about. Also parenteral, subcutaneous, intramuscular, and intravenous. You can see here that oral is mainly suffer from first pass effect, metabolism, and that will decrease the bioavailability. Rectal ortho, it may suffer from first pass effect, although it's less than oral, but around 50% of the drug can go into the portal circulation and may be metabolized in the liver. So that ends the route of administration. Let's talk about the first branch of pharmacokinetics, which is absorption. Just like any other material that can get into the GI tract, absorption means is the transfer of the material, in this case is the drug, from the GI tract lumen toward the venous portal system. That can go into multiple pathways if it's on its concentration gradient, so it's just simple diffusion. If it does not need a transporter, it goes directly through the plasma membrane. And remember, plasma membrane is lipophilic or love lipid, or the other word is hydrophobic. So if these drugs are very, very tiny, or they are lipophilic, they can easily pass from the highest concentration into the lowest concentration by simple diffusion. If they are hydrophilic or they are big, they need either a channel or a protein, but still in their concentration gradient, so that is by facilitated diffusion. However, some drugs or some ingredients maybe go against their concentration gradient, but the body needs them, so they also use the proteins. But now in this case, this may consume some energy through ATP, and that may produce that will transfer the drug from the GI lumen again to the systemic circulation, to the portal circulation, and eventually to the systemic circulation. Here we are mainly talking about the oral route of administration. Remember that this process is not needed in case of the intravenous or parenteral route of administration, because we put the drug directly into the bloodstream. What are the factors that influence the absorption? First, the contact time at the absorption site. So there should be enough time for the drug to contact the surface area, which is the usually the small intestine, where it can be absorbed. If things are moving very fast, so there is not enough time for the contact, and the absorption will be little. Example of such condition is where patients have diarrhea. So if the patient, diarrhea means contents of the GI tract are moving very quickly and there is not enough time for the drug to be absorbed. Total surface area, the more surface area we have for absorption, the better absorption will happen to the drug. Some conditions, such as people who, for example, suffer from surgery, removing part of the small intestine, that will decrease the surface area, and then the absorption of drugs will be decreased. So we should consider that when we give patients who suffer from such conditions, we need to give them drugs, we should think about the total surface area. Some other diseases, such as celiac disease or Crohn's disease, they may affect the surface area. If you remember from the anatomy, GI tract has some villi and microvilli that enhances that increase the surface area, which eventually enhance the absorption. If a patient suffer from a condition that target these villi and microvilli, so that will decrease the surface area. Blood flow, the good blood flow toward the small intestine, the better absorption, because if there is an increase in blood flow, that means any drug that is absorbed into the blood, it will be moving very quickly toward the liver and the systemic circulation. And a new blood with no drug in it will come and replaces the old blood. This will keep the concentration gradient active, because always we have a drug in the GI tract. So once we replace the blood with no drug blood, so that will keep the concentration gradient active from the highest concentration, which is in the GI tract, toward the blood. The structure of the drug, of course, the smaller the drug, the better absorption. And finally, pH and pKa. You should know the pH, the definition of pH and the definition of pKa from organic chemistry, and the major equation you need to understand that will help us to know the effect of the relation between pH and pKa with the absorption through equation called Henderson-Hasselbalch equation. To understand this equation, I just want you to know what's going on with drugs while they are in our body. So this is the plasma membrane, the phospholipid bilayer layer, and in case of weak acid drug, because most drugs are either weak acids or weak bases. In the case of weak acids, if we assume that this plasma membrane separates between the, for example, the GI lumen, and this side is the blood. So weak acid is symbolized by Ha, where it can give hydrogen, and there is an equilibrium between the ionized form and the unionized form. And because only the unionized form is easy to pass through the plasma membrane because it's lipid, so only lipophilic drugs can cross easily. The ionized form cannot cross that. So only at this form the drug can cross the plasma membrane, where it's again going into equilibrium with its conjugate base. Same thing applies with weak S bases. So B is the weak base in the unionized form. It's a weak base, so it accepts proton, and that will move it to BH plus, and this is the ionized form. It cannot cross, and this is the only form of the drug that can cross the plasma membrane going to the other side, and that again will go into equilibrium with its conjugate. Henderson-Hasselbalch equation says that if we have, in the case of weak acids, this is the equation between and the equilibrium between the weak acid and its conjugate base plus the proton. Henderson-Hasselbalch equation says that pH equals the pKa of the drug plus log 10 the conjugate base with over the acid. To simplify this equation, I moved the conjugate, this part of the equation into the other side, and that's where it gets the minus from, and I moved the pH to the other side, so the pKa minus pH. To further simplify this equation, pKa minus pH equals log 10, and now we change the numerator and the denominator, where now we have the acid at the top and the base at the bottom. Now, in case we have a drug with a weak acid where pKa equals 3, and again I want you to understand what is pKa. pKa is the pH. If we put the drug in that media, in that pH, it will produce 50% in ionized form and 50% in the unionized form. So that's going to be the equilibrium. In a weak acid, pKa equals 3. So if we put that drug into a media with a pH equals 3, so then half of it will be in the ionized form and the other half will be in the unionized form. If we apply this to our equation here, so if we have a pH equals 3, so pKa 3 minus pH 3 equals 0, and that means the amount of conjugate base is equal to amount of the acid. So 50% can be absorbed because it's unionized, and 50% cannot be ionized. So in acidic media, almost 50% going unionized and 50% are ionized. Let's see that what's happened in basic media. Basic media means pH above 7. So pKa is the same. pKa, it's a weak acid, 3 minus, let's say pH equals 3, alkaline or basic media, so that's minus 6. If we apply it to our equation right here, minus 6 means that the amount of the ionized form is 1,000,000 times the amount of the unionized form, and that is not favorable for absorption because the unionized form is the form that cannot cross the blood-brain, that cannot cross the plasma membrane, and the ionized form we have very little of it in the media, so little drug will be absorbed. So in weak acids, this is favorable. Acids in acidic media, it can be absorbed easily. However, in basic media, weak acids cannot be absorbed. Think about it for the same thing with weak bases. Just to make it simpler for you, a basic drug will interact with in the water environment and will gain proton and become unionized. When applying that into Henderson-Hasselbalch equation, remember that when you start with the equation, this is the acidic part and this is the basic part. So when you apply it to the equation, just remember to put it in that case, and then you continue with that. And if you continue in the same scenarios, the first scenario when there's pH equals 3, in a drug that its pKa is 9. So pKa 9 minus pH 3 equals 6. In that case, we have the ionized form is 1 million times more than the unionized form, which is not favorable for basic drugs. On the contrary, if we go into the basic media where pH equals 9, so 9 minus 9 is equal 0, that means the concentration of the basic drug for the ionized form is similar or to this is equal to the unionized form, and that is favorable environment for the drug to be absorbed. So this is favorable for the basic drug and this is unfavorable, which is opposite to the acidic. So in conclusion, acidic drugs are best absorbed from acidic environments and basic drugs are best absorbed from basic environments. Please remember this. We will come back to it in a different from a different topic when we talk about clearance of the drug. I will give you a homework. This is just for you to understand the Henderson-Hasselbalch equation. You can use the equation we did before. You apply it here. You try to find an answer. And please send me or write the answer, what do you think, at the bottom of this video. Now let's go back to the bioavailability. Again, bioavailability is how much of the original drug or the unchanged drug or the drug that's taken from by mouth in patient reached the systemic circulation. Please remember that the bioavailability for subcutaneous, intramuscular, intravenous, intraarterial is 100% because nothing will suffer from malabsorption or nothing will suffer from metabolism in the liver, so directly it goes to the systemic circulation. So bioavailability is 100% for the parenteral route of administration. Bioavailability depends on many factors. First pass effect, so because it will go to the liver, so definitely if the liver metabolize the drug in a higher amount, so that means bioavailability will be less. If the patient has a problem with liver function, so that also will affect the metabolism and that may increase bioavailability. Solubility of the drug, the more soluble, that means it's easy to be absorbed, so the higher bioavailability, and vice versa is true. Chemical instability in the, for example, acidic media in the stomach or basic media in the small intestine, if that media affects the drug and can make the drug in the ionized form, so again that will also decrease the bioavailability because it will decrease the absorption. Charged molecules or very big molecules can also be affected by absorption and cannot be absorbed. Proteins, they are unstable, for example, in stomach because stomach secretes a lot of enzymes that break proteins, so the bioavailability is not is very low in oral administration. So in that case, we think either about adding capsules or a gelatin to protect the drug, or we give the drug intramuscularly or intravenously if that's also feasible for such drugs. This figure shows in the x-axis the time after drug administration, and in the y-axis it shows the concentration in the blood. We can see that the concentration 100 in case of IV, which is in red here, intravenous, the whole amount directly reached the systemic circulation, so that is 100% bioavailability. However, PO means per aura, to orally, it does not reach the 100% does not reach it, so it's around 50% the bioavailability of the drug. As you can see, we can't reach the full amount into the systemic circulation because of the first pass effect. This is the end of the first part of pharmacokinetics. Please send me any questions you have, any misunderstanding, or any clarification for any subjects. Next time, or in the next video, we will continue about distribution, metabolism, and elimination. That is the other three branches of pharmacokinetics. Thank you for watching this video.